Everyone, welcome to the WorkTango Webinar series. Our topic today is how HR can empower their employees with their mental health. Getting started, what I wanted to do was first introduce myself. So my name is Rob Catalano. I'm the Chief Engagement Officer at WorkTango. We've been putting on these types of webinars every 3 weeks throughout the last year, really meant to help educate the HR and leadership community on new trends and things that are happening in the world of work. But you're not here to hear me talk today. I actually wanted to introduce our main speaker today, Terri Storey, who's the Chief Executive Officer of Snapclarity. And if you don't know anything about Snapclarity, it's a virtual workplace mental health platform. And Terri and I actually met about a couple of months ago at an HR event, and we just hit it off. A lot of good conversations of what's changing in the workplace. And this was a topic that was coming up a lot in the conversation we were having with our customers at WorkTango. So lo and behold, a couple of conversations back and forth, and then we decided, based on Terri's journey, education in the space, a lot of experience in working with organizations, we thought that she'd be great to bring on and have a conversation. So before handing it over to Terri, I actually saw some chats come in about someone not being able to hear. So again, if there are any technical things, please feel free to put them there, and we have a team responding and trying to help you out there. Again, anything questions on that end. But before giving it over to Terri, one thing I wanted to notice is I don't know if anyone saw this story that really blew up on social media about a year back. And it all started with a tweet from an individual. And what it said was on the screen: when the CEO responds to your out of the office email about taking sick leave for mental health and reaffirms your decision. And what it was she actually showed the picture of an email to her whole team saying, I'm taking today and tomorrow off to focus on my mental health. Hopefully I'll be back next week refreshed and back to 100%. And what then was shown in the tweet was the response by the CEO of her organization. And as you can read there, it says, hey, Madeline, personally thank you for sending emails like this. Every time you do, I use it as a reminder of the importance of using sick days for mental health. I can't believe it's not standard practice. You were an example to us all to help cut through the stigma so we can all bring our whole selves to work. And the reason why I wanted to share this story is that this blew up on social media. People were, it was crazy that was happening. It was unheard of. And that's actually the challenge, is organizations aren't doing these types of things. They aren't realizing how much of a stigma it is and the challenge that organizations or employees in those organizations have. And it was one thing that really struck back because, it's something that I believe is really important, the reason why I want to bring up this topic today. And it was just a reminder to me that people still don't fully understand the stigma of it, understand the impact it has on individuals and on our workplace. So if you haven't seen that story, look it up. There's a lot of good kind of discussions around that online. But I did want to kind of set the stage with that before handing it over to Terri. So Terri, I would say the floor is yours, but we are going to interrupt you a lot with questions and other things that are coming up throughout this. And as about 20 more people just joined, so this is meant to be a conversation. Please put your Q&A in, and we'll hopefully have a good next 53 minutes. Terri, the floor is yours.
Hey, Rob, and thanks for having me on today. So the global mental health crisis is real. It's one of the biggest threats to our nation today. It ruins health, it threatens lives, and it hurts economics. The social impact is costing us loss of time, productivity, and the greatest loss is human lives. 1 in 5 people struggle with their mental health. Right, 2 out of 3 of employees or team members are struggling and don't seek help, which is really surprising today, right? When you see all this plethora of information around mental health awareness. 43% of people do not have access to mental health or do not know where to find it. Why? Because of a broken system, right? Access, waiting times, cost, and stigma. And chronic illness is on the rise. Mental illness counts for 70% of disability costs, and depression is the leading cause of disability in the world. If we look at the traditional wellness platforms, they're underutilized. There's some lack of transparency around improving outcomes or not. And we see drug claims are increasing 12% year over year. If we look at the stat that I just gave you around disability costs, you can see this gap in what the benefit offerings today that we have. So for instance, it's called the paramedical spend. You know, most average companies have between $500 and $750. So you can see that disconnect if it's one of the leading causes of disability, but yet, you know, the least amount of money we have on it. And I think the second thing is, I think that it goes back to historical around what insurance meant. And that insurance was something that we bought kind of an emergency last resort, you know, instead of thinking it as being proactive for our healthcare and our mental health, right? And we're kind of like penalized if we actually like go get support for our mental health.
Yeah. Terri, I'm going to actually quickly interrupt. There was a question about where those statistics came from. There was, you know, 4 or 5 really good stats out there. What's the base of that, or where did that research come from?
So you can go on like the World Health Organization. You can go on Mental Health Commission of Canada, because those stats are very common and out there. But if we look at some of the impact, is that we just have like employees not coming to work. We have employees showing up to work, but they're not like at all focused or present while they're at work. You know, and it leads to like low engagement. So if you have people like in and out, or if you have people like not being present at work, it's going to like have an impact on productivity.
Yeah, and I'll even just jump in there. I mean, and I'm not sure if many people here know what WorkTango does, and but we help companies measure employee engagement. So what we're seeing is, you know, it's a challenge in organizations. It impacts everything from, you know, mental wellness as a driver of it to productivity in the workplace, and it's been one of the highest growing reasons why our customers are trying to dive in and understand the sentiment of their employees on a lot on obviously, you know, other components of wellness, diversity and inclusion, but this whole concept of wellness is something that is growing on our side. So we're seeing companies understand, and I think those stats are resonating with them and scaring them a bit and understanding the productivity issue. So just another lens of what I get to see from some of the insights coming in through the engagement measurement of those types of companies.
Yeah, I would have to agree with you like 100%, because we're out there in the market, and that's like, we're definitely seeing a shift. Like 2 years ago, people were recognizing it, but this is like the timing and the synergy, right? If people are out there, they actually want to take action. So
yeah. And you know what's funny is you think about the engagement equation in itself. You know, 10 years ago, we were all waving the flag of it's important. Start with focusing on your employees. That will drive better customer sat and success of the business. And now people are kind of there, right? Like many organizations kind of believe that, understand it, and invest in that. And I find that this topic is going through that evolution where there's still a lot of us waving the flag, but some people haven't really jumped on board yet. It's starting and it's getting there, but it'll be a bit of a process.
I think so too. And I'll talk a bit about like a couple of myths, right, that are still like right there in front of us. In May 2019, right, the World Health Organization called burnout, or declared that burnout was an occupational phenomenon, right? Which is like when workers are like exposed to chronic stress over and over, and they, you know, it has not been managed. We live in a society of always being busy, you know, constantly, you know, getting it done fast and quick, and kind of not finding work-life balance. So for me, moving from like a bricks and mortar to like a tech space, I've definitely like, and the colleagues around me and peers and friends, I'm definitely seeing this. And like, if we stop and think about it, we've all been touched by like mental health, right? We would have friends, family, colleagues, or even ourselves. You have gone through a life event or something has happened, right? Because like some of the, you know, 3 common mental health would be like anxiety, depression, ADHD. So, and, you know, I think this is really important to address, and I will bring it up again, is that mental health doesn't end at home. And that's one of the, like, I think, important stigma, right? Because I think a lot of people think that you can turn wellness and unwellness off and on. So it transfers to the workplace. And this is like really important to me, is that mental health is, you know, a society-wide issue, and that we're all in it together, and we all have a responsibility. I tell employers, you know, we're all in the healthcare business if we like it or not. And it's time that we start to make change and taking action, because mental health is an issue.
So Terri, we didn't plan any of these conversations, but you talked about it's time for a change. And I'm actually just interested in the inspiration between even, you know, starting up the organization. Like why Snapclarity? What motivated you? Because you're right, there is time for a change, and companies like yours are starting to make that effort. So not sure you're comfortable, you know, talking about it or discussing it of what that was, but I'm very interested.
I've been in this space for 20 years. And I run a bricks and mortar that we offer therapy and psychotherapy. So I've been doing this for a really long time, and we could just do it really well and improve outcomes. So when you experience people going through the frustration and the pain of like trying to get support when they still have to deal with their mental health is not okay. So it was just, for me, this is like, we did it really well. And we're like, now we're going to like offer it to everyone.
Gotcha. And I guess I'm assuming that's technology enabling to do that in a broader scale than the bricks and mortar.
How do we scale that? Yeah, totally. Great.
Great. Thanks.
Right. So now, in the next section, I'll talk about like the foundation of a mental health strategy, give some key consideration, and we'll highlight some concepts. So I think the very first thing is always, everyone talks about this, like, what is mental health? How I describe it really nice and easy to people is that it encompasses everything from like your physical, mental, and social. And it's about the foundations that people have to be able to overcome struggles. And I think what's really important today is that we actually put mental health meaning the same thing. And I'm sure, Barb, when you think about it too, is like, so we use mental health both in unwell and well. I catch myself all the time because I like, patients calling in and we're chatting with them, right? I'll like put the two. And I think though that in itself is telling people like, it's just as important as physical health, right? So assume it like that, right? And I think when I think of unwellness and mental illness, that actually comes down to like, that's the impact of not being well, right? Your thoughts, your emotions, your feelings are distorted. So it changes your interaction and how you behave to different triggers and life events. So I really explain to people that there's a continuum. So you have on one end, you have like high functioning, adaptive behavior, right? To the other side of that continuum of like being impaired, injured, and maladaptive behavior, meaning not making the best decisions, right? And people, right, can move across that continuum over their journey, right? Over life cycles. So different things could happen at different times, and you could be functioning and then something happened and you're not. Very common, situations could be like divorce, aging parent, right? Could cause triggering events that you could be thriving and functioning to move over to this, on the continuum to the other side of impaired and injured. I think it's important to understand that every day employees have mental health moments, and it's important for companies to have resources and tools to support them on that journey. 5 challenges on improving the workplace mental health well-being. So if I look at number 1, for leadership to actually decide that mental health is a priority. And number 2 is around policies and procedures are usually driven by events or past things that's happened with staff, right? And I find that policies are actually out there to protect employers instead of prevention, right? Because it's based on fear. And if we look, number 3, lack of insight. And again, this is because just like not understanding that mental health doesn't mean that I have to be contained in a hospital. Common across life cycles, and there's a continuum of it. Number 4, for me, I look at as like poor evidence and based to measure investment on the well-being strategies. Employers are looking outside. They're like, it's broken anyways. What impact could I have? Does it really matter? And this is the time that you and I were talking about before, that it's like becoming, forefront and top leaders are talking about it, right? It's the biggest thing that's on HR's mind this year. And I think lack of collective knowledge of best practice. HR is being inundated with wellness tools or products saying they're going to deliver this, and they just don't know what to choose. The objective here is to kind of evaluate your current resources, what you have over like the individual, the organization, and ultimately the culture. And I think it's really important to also address what could be the risks of your current employees. So, and I think some key considerations of this is like leadership support. You need to have buy-in from your like leaders, from the C-suite, I call it, and then there needs to be some identification of managers, looking at, functional champions within the company. If I look at the like day-to-day management is looking at cross-functional committees, in order to process, inclusion. If we go look at communication, is that we have key messaging, and what that would look like when you deliver it out to your staff. You know, some suggestions would, you know, that it's on demand, like a kind of a marketing campaign. Number 3 is implementation. And again, if we look at that as like looking at key considerations would be like your benefit program. Are we offering, you know, the most robust programs to our staff? You know, what is the best programs out there to meet the mental health needs, right? Looking at kind of some like, you know, low-hanging fruits, I said, that'll have the biggest impact on staff. If we look at policies, again, it's like continuously revamping them and reviewing them. And again, when we're going over those, especially today, we actually have like employees who want different kind of benefits at different times, right? So looking at what we could offer to our staff. And again, I think being transparent about that. And, you know, the last one is like evaluation. It's around the data. So, you know, the decisions that you're making as a company is to be able to track that data on productivity, healthcare cost, improved health outcomes, right? And keeping everyone aligned and the key stakeholders knowing about that data. So this is like a really great slide. And it took me a little bit as I was working it through, and it was done by Deloitte, but it's actually can show us a couple like flows around, you know, a proactive mental health strategy to like one that's very reactive. So you can see like over here, you have an employee who's in good health, thriving, functioning at work. And then you can have like a common, you know, life event, like let's use caring for aging parents, right? Or something happens with that. So you can have them function. You can see them kind of moving along that. And then there's a time where there's like in need of help. So again, if you have a company that has like a lot of like openness, some mental health awareness, and you have the right tools and the right resources, you have someone like taking the steps to reach out to help, right? And so you can see that they continue to like stay on the path to work, right? They'll stay like somewhat functional. And you can see that even if there is at the top, if they have to like a decision to like maybe leave for a couple of weeks, if that was the treatment plan, you know, they're right back at work functioning. So if we take it the other way, so if we look at like the number 6 on there, and if we have, again, an employee in good health, thriving, something happens, like a life cycle event, and we're not, you know, very proactive, and we get to stage 6 where it's reactive, you can just physically see that, right? That it's like they, you know, dealing with this crisis, you know, the anxiety that over and over for a long time without seeking out help. And you can see over here now how long that can take and how costly that could be to actually get people back to work, how the cycle could go from leaving to not leaving to coming back, and the expense that would take on the company. So ultimately they could be leaving or on long-term disability.
So a question that came in is that you show those 4 stages. Now, is that typically, like what role in an organization is typically focusing on this? Like it might be the head of HR in a smaller organization. It might be, you know, different divisions of HR, whether it's maybe comp and benefits or something on large organizations. Any insights to which part of the organization or which roles are really focusing on that journey or those 4 steps in your experience?
Yeah, so I know it's definitely HR, right, that's focusing on that, right? And I do find it coming from the leadership, right? So it's been quite an interesting journey for us as well out there, that we definitely see it from like the C-suite coming down, then benefits in HR, and then from the brokers, the insurance to the carriers, right? Everyone's taking interest because the cost of mental health is very high.
Okay.
And I think what else is very important is that a holistic mental health strategy needs to include both. So we have this, and lots of people talk about this, is workplace psychological health and safety plans. And then we have to include that with mental health tools and resources, right? And the supports that we put in place to get people better. So 5 ways how you can improve your mental health strategy. is one. Assess your existing programs. And again, we were, chatting about this like a few minutes ago, is like really establish that baseline. So evaluate what you have, look at, what the utilization rate is of your current wellness program, look at your spend, potentially, doing surveys, asking people about, their absence from work, right? Chatting with them.
Quick question here. Like I've worked with organizations that had EAPs. I've quite honestly never used or leveraged it and probably should have. Are there any like stats around like how many people actually use EAP programs or like, because I find that people are going to do a baseline, they're going to, find out what's working, but I think they're going to find a lot of what's not working. Any insights on that?
So yeah, so the National Standards Anywhere, like it's 4% utilization rate over the year, right?
Wow.
So we are seeing utilizations really low. Like number two is like engage your people, right? And I think this one is really important. And especially with like the younger kind of generation, is just like having working groups, chatting with them, right? Doing surveys, engage them along this process. And an interesting one, if I go back to this, is that I've been speaking on like a lot of panels or working with some companies. And, one of the companies that we've been working closely with is like Shopify, and we sit on some other panels together with their HR and their benefits. And they've done such an incredible job of engaging their staff along the way and their employees around kind of what they need and kind of what benefits they need, and like we were talking about some of the surveys and the questions, and the number one thing for them was to have a mental health solution at that age, right? And we do find that that younger generation just puts it all out there. They like to talk. They'll tell you exactly what they need and what they want. So I think, when we're looking at psychosocial factors in the workplace, from the leadership down, is that people can come to work and feel they can be themselves, right? They can make mistakes, they can have failures, and, and it gives them that ability to be creative.
One thing that what I found is obviously in being in the space for so many years, helping companies assess employee engagement, what drives me crazy is there's organizations that are using models from 10, 15, 20 years ago that don't look at modern components of engagement today. Things like diversity, inclusion, things like psychological safety. And I think what they're missing is these types of understandings of, one, how do people feel like they can bring their full selves to work, or they feel that they have these types of conversations to be open about it without, fear of anything negative happening. So it's just one thing, a big reason why I was mentioning earlier that it seems to be growing in terms of companies really trying to understand the space, because they haven't been before. And it is, if you can have those conversations and engage employees in those discussions, they'll be part of telling you what's important, part of the solution. So I think it's really important to really understand that, this element of it, because, at the end of the day, it's our employees we're trying to protect.
I agree 100% with you, right? I think if we look at, some of the like barriers like accessing mental health care, I think this is an opportunity for like employers, when I talked about taking action, right, is that they can actually really have, leverage around what is the best thing for their, employees, what they need, if they truly understand kind of some of the barriers to accessing care. Number 4 for us is like leveraging technology. I think that virtual telemedicine has become more popular in the last couple of years, and how that people then can use solutions anytime, anywhere. And I think also the greatest thing about technology is the data that we can collect, right? On a sense of like how to make that better for the user experience.
It's funny, in my building, there's actually an office that allows for kind of checkups and check-ins. And I went there the other day, and it was literally someone on a TV. Like, I'd never experienced telemedicine, but it was amazing. Like, there was no one there in person, but it didn't stop me from going to get help or support. Whole other side story. It ended up being a friend I played hockey with who I didn't recognize on a screen versus with a helmet on. But it was an interesting way that technology allowed me to go get care in a time when I probably wouldn't have got if someone wasn't local, in that location.
Oh, and I agree. So this, like you brought up that great point, right? It's like time, right? You can do it, controlled on your own, right? That there's no stigma to that. You can like do it at home, right? You could go for a walk outside, right? Like there's like, it definitely gives us this convenience, right? And I definitely, like I mentioned before, you're definitely seeing this trend, and we're definitely catching on here in Canada to use that type of like telemedicine for our healthcare. So I think the future of mental health care needs to go is that people need to adopt a collaborative model, which I consider like a connected care or value-based care. And if we look at the future of like kind of a value-based care, mental health care is like, number one is that it's like very patient-centered team care. And what this means is that like not all one size fits, you know, the person, right? That you have to be able to have options from virtual to offline to concierge service, and truly believe in like early screening to provide the user with the right, you know, skills at the right time. And again, and it goes back to like the you know, we talked earlier and I brought up this confusion, right? Or this lack of knowledge that HR leaders or employees would have about it, is that one of the best indicators, like 57% of people improving symptoms and reducing treatment times, is what's called therapeutic alliance. If we can actually match people to the right caregiver at the right time, like how fast that can be. And that's the number one indicator of like the success of therapy. And then we can actually drop the treatment cycle to 16 to 14 sessions by 75%. That evidence, like, it's not normal in mental health care when you're looking at stats. So the second thing that's really important is evidence-based. So again, evidence-based care means, because there's like 80% of therapies out there that do not work. And then we have 20% that do. And I think that's really important for people to understand. And I can give you an example. So, and I'm sure you've heard of this, like everyone, you know, HR and stuff are talking about ICBT, or cognitive behavior therapy. So cognitive behavior therapy is very near and dear to me, and it is very effective to 20 to 30% of people, but it's a very expensive therapy. It's a talk therapy. It's based on cognitions. So, and usually how it has to be delivered to be evidence-based is that you need to have FaceTime, you need to be doing modules, you need to be getting, you know, support offline. You can't default to any sort of other treatment. And that's what the evidence-based is. So now we have like things, you know, people wanting to kind of rip the actual good parts of that away to offer things like modules or, you know, kind of a pseudo-informed CBT, which is not yet well researched, right? That we're like, you know, not seeing a lot of results. We're still seeing very high dropout rates. And so I think that's when I talk about what, you know, what people need in organizations. They need to spend the time to understand what actually works. And it goes into my next thing is progressive measurement-based treatment. The biggest thing is that, you know, we need to start to measure people's progress by using validated measuring tools. So an example would this be, you know, if someone's getting therapy, that we start to like validate their symptomology, we start to track their behavior and put that stuff together, right? So that, you know, therapists could reach out if it's not working, we could change the treatment plan. So, you know, altogether it becomes this accountable care. And that means that if we're going to start to be using money, right, and we're therapists and doctors, we're taking that, so we have to be accountable to providing quality care. And we're using evidence-based products. We're measuring that progress, and we're being accountable to improving outcomes, right? So in the last one is kind of like the patient data, which is like kind of something I'm so happy and so inspired about, is that, you know, and that's one of the biggest fragments in mental health is like, we haven't been able to like move patient data. And I talk about this is because, again, this is like technology, how it's improving is that, you know, we can now move it, you know, there's new compliances coming out that we can actually like share patient data safely, right? Without risking that breach. And the second thing is also about the ownership of your health record. So, you know, what's changed? Like, think about this. You could never leave a hospital with your x-ray, or you couldn't leave with your blood results. Now with, you know, Apple Health and Dial, you can actually like, you know, move your personal health record up there and share your information with people when it matters the most. And so we're owning our own stuff now and taking control of our mental health and our healthcare.
So how, I guess, how far are we away from this future, or is it a reality today, or?
It's a reality today, right?
Okay.
I think like it's taking the steps to like like the adoption of virtual care and telemedicine, and I think because the market's being inundated, is that evaluation on products around what are they delivering? Is it evidence-based? Are they measuring progress? Are we getting value for our dollars and cents that we're spending?
Okay. And appreciate the education part of it. And in no way, I know you didn't want to make this a sales pitch by any means, but
totally.
if I think about, Snapclarity, is that the idea, is that it brings these elements all together into one for organizations that are trying to improve, mental health for their employees?
Totally. Yeah. So that was because I've been in this space for so long and doing this, and that's how we run our bricks and mortar, right? It's very about quality care and effective care. Because again, you need to be improving outcomes. Because I kind of joke with people in mental health care, think about it. If you hired someone to do your marketing, or hired someone to do a campaign or project, you would expect at the end that you're going to get something, right? Right? If you're spending dollars and cents, it's the same with mental health care, right? If we're spending, lots and lots of money, and we need to be, so it's an industry that has not had to be accountable. And it's just about time that, there needs to be lots of changes, including that one, that we need to be accountable to people's care.
Mm-hmm. Well, I mean, it's no different than I think what's happening, holistically in the HR space in general, right? Companies have been doing annual performance reviews for 100 years, and, they're finding they're not working, but they continue to do it. Or, doing a survey every 2 years. It's hard to be agile on getting that feedback. And I think, there's a lot of elements of the HR space. I think technology, one of the big pillars you mentioned, is really helping accelerate in companies. So it's nice to see that obviously this evolution is happening, in the mental health and wellness space as well.
Well, and this good point. And I think some of the stuff that's really important and always very simple, if I have to break this down for people, is 80% of people who get therapy just get better, right? They stay functioning, productive, they're well. So, and I think, it's so complex out there. If you think of it in those simple terms, it starts to make better sense.
Okay. So I know that this is that was the kind of the slides you had, and we wanted to make it a little more of a conversation. There's about 4 or 5 questions that I knew we were almost near the end, so I want to save till now. So let's dive through some of those questions right now. And some of them will be a little relevant to accountability here, but I want to circle back to some of the other slides. And one question was, do you have any ideas how to promote psychological safety within a workplace that has been toxic in the past? Not sure if you have any thoughts around that.
Can you just repeat that one again?
Do you have any ideas on how to promote psychological safety within a workplace that has been toxic in the past?
Yeah, I have some recommendations, right? I think, especially when it was toxic in the past, is kind of going back through the way we talked about that mental health strategy, right? Is that you're engaging your staff in that process, right? You're kind of getting their feel of what they think is toxic, right? Listen to what they're saying, and then start to go back to your values and your core characters, and who you are as a company, and start building and working on those policies, right down from assessment to exactly the 4 state that we walk through.
Yeah. And one idea as well for the person that asked that question is there's actually a really interesting concept from the book Good to Great from Jim Collins called brutal facts, and it's something I've been doing for the last 12 years with teams and organizations. In kind of my history. And the concept of it is every quarter sitting down and asking the organization, what were the brutal facts, right? And finding out, being open about it, and then looking at those brutal facts. And sometimes I've had quarters where there's been 30, sometimes there's been 3. So it depends on the quarter. And then actually sitting in a room with the employees and saying, okay, well, here, help us prioritize which of the things are the most important. And what happens is employees aren't just giving you what the issue is or the dissatisfaction. They're actually part of participating in the management of how you create a better workplace or fix those items. So I find when you bring people, especially in the concept of psychological safety, being able to sit in a room and have an open conversation, I find that brutal facts process really worked, because now they're not part of giving feedback that goes into a black box. The company's making an effort to go have a discussion around this and how the organization can move forward, how employees would feel comfortable. So that's just one example I've seen work in the past, not specifically to psychological safety, but it helps build it.
Yeah, I agree 100%. I think that was kind of the mind shift that people need to go from what we call utilization to participation, right? On engagement, right? It's not about this utilization, we talked about that EAP, that 4% utilization, right? Is getting to people to participate and engage.
Yeah. Okay, another question that came up was, you talked about accountability on this slide, and how is Snapclarity ensuring accountability? Not knowing much about the product.
Yeah, great question. So I think when you look at it, and I used some words, and I'll kind of like break it down so people really understand it nice and easily, is that, if you look at a customer that's coming through and they start, down the path of therapy, that you're actually starting to measure and using validated tools, meaning that they're golden standard out there, to actually measure that we're actually looking at their clinical symptoms and are they improving, right? And we also start to look at other things like, data tracking and like behaviors, and using other measuring tools to measure like kind of functionality and life skills, right, through that process. And then if it's like, different, or there's like improvements, or there's a change in those symptomologies, then that the, healthcare professional would go in and like relook at the treatment plan again, right? And reevaluate, is it working or is it not working? Because think about it, of how it works, right? Is like how we work today is that if you like feel like terrible, right? You then seek out care options, and then we gather data, right? I'm all about like gathering the data, and then the right care options at the right time come, right? And then we have this like improved outcomes and sustainability. And we have also accountability on individuals, right?
Great. Appreciate that. Thanks for the question. Another question I really like is, which companies are leading the way with innovative mental health strategies? What are they doing? Any examples of companies or stories around that?
Yeah, I think there's just so many great companies, right? I think like Snapclarity, right? When I talk about it, but like, a champion, for us is definitely RBC. Bank is definitely in that space, like even with their own employees, and kind of different insurances and different benefits that they're offering, right? And looking at like a marketplace kind of like, benefits to kind of service, our different demographics. They've definitely been a champion of mental health forever, right? And really looking at ways to support us, right, during our mental health through that stuff. Like a company like Shopify, who again, incredible, right? You look at companies like League Health that are coming out and actually giving like a very different persona, right, of taking control of your benefits and making decisions about like, to take action, and let's think proactively, right?
Okay, great. Another question that came in, really like this. Do you see companies changing their time off policies to PTO versus vacation and sick time to erase this stigma?
Yeah, that's a really good question, because we've also talked about it within like a couple of my, what we look at. And I think it comes down to that. I think it's really important for people to be able to be self-aware, and so around when they need time off to be able to recharge. So I think work-life balance is then left, and I keep it open with our employees, right? That if they need to take this time, and they don't need to tell us why, but they can like have those days, they can flex their time, right? And I find that is kind of, a solution to kind of make that work, right? Is that work-life balance, right? So, if they're not, for me, it's not, and I think that's a mind shift change. Back, I can remember 10 years ago as an employee, everyone had to be at work. And if they weren't at work, even I questioned as a CEO, like, oh, they're not working if they're not in the office, right? Where now it's a totally different way, right? People are very like, kind of have these flex schedules, they can work from home, and you'll have way happier staff and more functional and get more creativity, right?
Yeah. I mean, speaking to even experience, recently WorkTango, we just provided an unlimited vacation policy, right? Let people take the time they need for personal, mental, whether it's just rest, whether it's just getting away. So I've seen a lot of companies follow suit recently to provide that level of, kind of flexibility in that world of kind of getting physically, mental, financial health all across the board.
Totally. I like that actually. And I think like if you as a leader just put it out there, and be open about mental health, right? And then your employees will. Like I've had some staff kind of come over from different places because I've been just around it my whole career, right? So we just put it out there. And it was like interesting when they make comments like, this is not normal, this is awesome, right? Because employees can just come in, they just know they can talk like, oh, I'm having a panic attack, or I'm really anxious today. And it's just like, that's kind of normal, and it's just totally acceptable.
Yeah. Okay, so this is a bit of a long one. So what do you think would be a good emergency tactic, emergency was in quotes, when something happens in the office? So as an example, a specific professional expert to call for an employee to speak with, or a place to accompany an employee, whether it's a real emergency or a soft place to land kind of location. Any ideas?
Yeah, I mean, that's like, so just, and I'm bringing my company, it's just because we've had to deal with some kind of emergency situations with HR, right? When something happens with an employee. And mental health is one of those tricky things, right? That we can't order people to, to like get care, even though, we know they really need it at this point. So, we've definitely had, HR reach out to us in emergency, right? Especially when we've had some, where employees feel suicidal and have actually disclosed to their employer. So, we really support HR walking through that, right? Because it's kind of like, what's their legal obligation? What's their also caring obligation, right? Just as being a human being and, and how to respond to a situation that takes some tact, right? And you've got to like have a safety plan in place, which is great with, services coming out that offer concierge customer service to work with HR, right? Because, they don't understand their legal obligation, right? It's kind of like hear no evil, see no. They're like, I wish you didn't tell me that at this moment, right? So, but we, need to take care of people. So, there's a process, and we just support them through that, right? Through that.
Okay. Wonderful. Another question here. We have a workplace that has language barriers and employees with different cultures. How can we promote psychological health in this type of environment?
Yeah, I think that, comes right down to like kind of when we talked about setting up a mental health strategy and looking at programs and resources, I think that's part of your evaluation process, looking at like, what are the needs of my employees? What kind of programs do we need? Checking that off, right? And getting ones that actually meet your needs, not just out of the box one that everyone's using, right? That it's like, right? Because it could be different everywhere that they are. So that would be a very important step.
That actually, I mean, I don't know if how you plus one this, or one thing I'm thinking is that that's not just, I'm thinking above and beyond languages, right? You think about across geographies, like to your point, there are some regulations now around mental health programs and things like that, maybe in Canada, but if there's other organizations or other parts of the world where your employees, there aren't any of those types of policies. Any other thoughts around, just beyond language, even just, location wise? Any way we can promote psychological health in that type of environment?
Yeah, and to go back also to the last question is like using again, those committees, setting them up, right? Inclusive teams being involved, right? Kind of looking at all that stuff. And I think, and again, that last one that you brought up was about the virtual kind of, right? Like people kind of being all over. And I think, again, it's just going to reevaluate that kind of culture, right, of being virtual, and how do you support your employees? How do you, create this space that's, creativity and being yourself and free from harassment and violence, is important. So I think starting from the top, you have to start to look at how you're going to engage and how you're going to create a culture, regardless of the working space.
Yeah. And one thing in running a number of programs, across the whole employee base, one thing I've seen, and you mentioned it briefly, Terri, and one of the steps was finding those champions, right? If there's a champion in that location or with that type of employee, someone that could be the voice of those individuals through these types of programs, then at least you have someone there who can help identify what the issues might be really relative to that group, but also be kind of that communication path to anything that's rolled out, especially if there's some difference in how it's rolled out. I always find there's champions and passionate people in your organization that are waiting to raise their hand. So I find there's a good opportunity for that as well.
Oh, I agree 100%. Right around that, setting up those cross-functional committees, and I think it also that one question that came up around toxicity. How do you change it around? That's a very first step, right? Is getting up committees, because if people if the past, because people always make decisions on past behaviors, right? And also don't always trust what's going to be put in front of them. So having those champions, creating those committees that actually can then, talk to, where people have a voice to be able to go back to those champions to bring it back to the C-suite, right?
Awesome. So for everyone that's on, there's 3 more questions here. I did want to just briefly, before getting to those last 3 questions, just let people know that our next webinar is actually in 3 weeks from now on September 12th. It's actually with Carolyn Swara, really around happy employees, happy customers. So how you can create these purposeful workplace experiences and create inspired and empowered teams. So, where you saw this webinar on our website, this one will be right beside it. So feel free to register for that, if you have a chance and if this topic interests you. And then, while you're on our site, there's a whole level of resources, blogs, etc. that you can find interesting in terms of not just employee engagement, but these types of topics that we have with our webinar series. And a lot of our webinars are on demand as well. So if you want to access them, feel free to. But what I did want to do is circle back to these questions in the last 5 minutes. And actually, it looks like a lot of them are very specific to kind of the tools, but and Snapclarity in general. But is your AI open to allow other platforms to work with it in order to streamline the process, similar to the Ontario Healthcare Term proposal?
So that was like one of the things when I brought up patient data that I was very excited about, right? And one of the things with technology that we've done well is we can actually like maintain people's like data, hence why we could get into them before they were like, walls. So now with these new compliances coming out and new kind of technology to be able to move data. So hence, being able to work seamlessly with vendors. Because again, I brought up that not all one size, fits mental health. And to provide good mental health, you need to actually have good triage, good early screening, and then identify the right care at the right time, which could be like different kind of vendors. So how do you scale that, right? Is like you need to be able to move your data, right? To be able to scale that to like bring in a different provider, a different vendor to be able to do that very well and safe.
Okay, great. Another, I guess, specific to the tool, the anonymous attendee. There are so many mental health tools and resources out there, MoodKit, Happify, yours, etc. Do you have a recommendation on where to find quality and trusted resources in order to create a mental health corporate library on our website?
Yeah, for sure. I think like when we talked about that before around, evaluation, I think that it's like companies really evaluating what they need and what they want, right? And then checking that box off, right? Because if you're spending some money on something, you need it that it's, evidence-based and it's quality, right? So I think it's identifying, that mental health, is affecting most people, right? And like that, again, that simple stat of 80% of people who get therapy get better. So, that has to be part of your strategy, that people have access to quality mental health care, right? And that stat that I gave you, that like 75% we can reduce treatment times with this therapeutic alliance, right? Using therapy to a good match. So I think that's like, how they can identify good tools and resources to actually like, to use, because you're right, the space is like heavily inundated right now.
Great. I guess a little more specific to the process, how do you differentiate the specific need of the individual and channel them to the most experienced therapist, for example, PTSD, emergency service worker?
So again, it goes down to like this, value-based care and connected care is that you gather the data at the beginning. So it's very important to do appropriate early screening, because I tell people mental health can all look the same. ADHD can look like post-traumatic stress, can look like bipolar. So you need to capture that data and, some other contextual data around behavior and chronologically, or like what's happened over some time. And then with that, you actually then need to choose the best treatment pathway and then match them to the right skills. So that matching criteria is, again, going back to like that stat that I was saying, 75% of matching to the right healthcare practitioner at the right time is the biggest indicator of improving success outcomes. And 6 to 14 sessions in evidence-based therapy they will get better.
Great. Yeah, it was quiet for a while, but all these questions, which is great. But we have one more question in 1 minute, just changed. So hopefully this will likely be the last one. It's Jillian again. Hello, Jillian. Would Snapclarity be willing to share some initial data to help HR professionals, in quotes, sell your technology or even a better wellness strategy to senior leaders? So any kind of executive support on that end. For example, on average, when companies implement Snap's tools, the company sees productivity go up by X.
Yeah, so, and it's a great question. I think that's the transparency that I talked about, right? Is that, you know, that the data sharing again is, you know, rated around kind of what are some of the high risk areas within their, you know, company from depression to anxiety that we could note fairly quickly, you know, also utilization, but it's also, are we getting people better, right? So that's just about like, you know, what therapies are working, you know, the timeframes for that, cost. There's a lot of things that you can break down within that data to start to make really good decisions around future items, you know, that the company may need. But then it's also relating back to like work productivity, ROI, drug benefit costs, you know, what does that look like and how do you continue to improve that with the data and the data that you're capturing? And building that case for us is critical, right? But it's because there's really no, I think that people lots of times, or you'll read lots of data that people actually say, oh, it's worth this, it's worth that. But it's actually going to take, which doesn't exist, right? All of that data and putting it together and really breaking down cost to understand the outputs of that.
Great. I would take the opportunity to maybe even send Jillian some of this, you know, some of these details, or maybe a blog on some of these actual stats that could help them sell it to senior leadership in their own organizations. Might be valuable stuff for everyone on this webinar.
Totally, we could do that.
And Rob snuck one in, a question at the end here. It's 2 o'clock, but why not? As emergency services, we currently operate under a 3-pillar approach. Your platform falls into the 3rd pillar. Once engaged, what does your transition from online to bricks and mortar look like? And are there triggers that allow you to transition a person of concern without consent?
So those are great questions. So like, again, you look at things, like I said at the beginning, that you need to, like, one of the things is about patient-centered, meaning that you have options. So you can have in-person FaceTime, and then you have this option, right? If they require like a psychiatrist, I guess, you know, would be this like kind of 3rd level of care. And can you make that referral? Yes, right? That's the quality of care and that's the continuum. But like the last question that you asked about, can you like make someone to go to mental health care? No. So like, and I think that's, you know, if we live in a society that we can't order people to treatment in Canada without going to court. You know, we can't order someone to a hospital, right? That would be the determination of the, you know, the psychiatrist that's on site that day. If we do look at it, you know, 2 different things like long-term disability and short-term disability, you know, a person, they could, you know, deem in that treatment plan that they actually require therapy to, you know, continue to get benefits, and what that treatment plan looks like, very individual. So there are sections, you know, with that, you know, if they want to continue to be getting benefits, right, they would have to adhere to their treatment plan. But legally, in a whole thing, so that's where, you know, that could mandate that for them to get that. But legally, you know, we can't order people to treatment.
Great. So we're a couple of minutes over, but you know, nice to sneak in that last one. I really appreciate the questions from everyone that joined today and participating. Like I mentioned earlier, all this information will be available on our website and be emailed over to you. I'm sure there's some great additional resources on the on the Snapclarity site. So Terri, thank you again for participating and answering a load of questions at the end there. You know, something that I think should be, you know, shouldn't be a surprise to anyone anymore when organizations go down this road. And I think every company is starting to get on that same path. So again, thanks everyone for joining. Terri, for your insights, and have a good rest of the day today. Bye, everyone.
Bye.